PCOS is a really common condition that we see. It usually affects patients who could be really anywhere in their menstrual years. It's basically characterized by irregular menstrual periods, a higher predominance of the male hormones, and then it also can represent, obviously, polycystic ovaries, where those abnormal hormonal findings are causing small cysts to form of the ovaries because the hormones aren't reaching the appropriate levels. In order to treat this, we usually will treat with medications like combined oral contraceptives or even progesterone-only hormones sometimes can also help with this. And it helps to create a more normal menstrual pattern. And then we also can treat with weight reduction efforts to help reduce the triggering factors on the endocrine system that cause it to begin with. So what do we recommend? You are more than a number. So looking at your hormones on paper doesn't mean that we don't need to do anything about it. Whether it's hormone replacement or maybe a temporary use of oral contraceptives or something entirely different, we have a lot of treatment options for your symptoms. So definitely come in and talk over with your provider any of these concerning symptoms, and we can determine what might be the right treatment strategy for you.